right. Our next speaker is a physician, researcher, ophthalmologist. Did I get that right? Ophthalmologist. There you go. Whew. Public health advocate and associate clinical professor emeritus of the University of Texas Southwestern Medical Center in Dallas. Please welcome to the stage the author of The Ancestral Diet Revolution, How Vegetable Oils and Processed Foods Are Destroying Our Health, Your Health, Dr. Chris Knobbe. Thanks very much, Chris.
There we go. In the year 1900, heart attacks were so rare that the vast majority of physicians around the world had never witnessed even a single case in their entire careers. Yet by the 1950s, coronary heart disease had risen to become the leading cause of death in both the United States and the United Kingdom. What could possibly have changed to induce this? What if the greatest shift of the past 150 years, the one that you and I have been told is heart healthy, is actually and ironically the primary driver of coronary heart disease and the driver of obesity, diabetes, cancer, and more? What if just a single dietary component quietly introduced into our food supply about a century and a half ago, steadily rising across the globe, now with almost universal acceptance, is slowly and silently poisoning us all? I want to take you back to the year 1859 in Sweden. This physician, J.P. Malmsten, attended to a patient who presented with the most unusual constellation of symptoms. This patient's primary complaint, what we would now call substernal chest pain. Dr. Malmsten cared for this patient on a daily basis, and despite his best efforts, on the 6th day after presenting, this patient died. The case was so unusual, so strange, so perplexing, that the attending physicians decided to present the case here at the Swedish Medical Society that year. The attending physicians were J.P. Malmsten, as I said, family practitioner, and then professor and pathologist Dr. von Deuben. Both Malmsten and von Deuben were of the Karolinska Institute. I guess I've got that right. They're both highly esteemed, prominent physicians, very experienced. The date was 27th of September, 1859, when they gave this presentation. Here's what the two physicians said about this patient. He was a 66-year-old male. He presented on Wednesday with cramp-like pains under the sternum. On the Friday, a quarter grain of morphine was given. This is because the patient had anxiety and pain. The following Tuesday, Dr. Malmsten reported this in his own words at the Swedish Society meeting. He said, 1 hour after I had left his bedside, the patient was attacked by severe choking. His chest labored severely. His face became blue, and after a quarter of an hour of agony, he died. Now, Malmsten told the Swedish Medical Society in his own words this: the diagnosis was obscure. Now, that statement, I think, should be one of the most profound statements made in medicine in the past 200 years, and you're probably thinking, why this little statement? Think about this. A patient in 1859 presents with crushing substernal chest pain. He labors severely over the next 6 days. He founders, he fails, and he succumbs to this on the 6th day in cyanosis, and he dies. And the attending physicians have no idea what this is. Anyone in the world practically who's probably, at least in high school, would pretty much know what this diagnosis is today, right? But why did they not know? There's good reason for it, and I'll come back to that momentarily. So the post-mortem was carried out the next day by Professor von Deuben, and we'll come to this. Now, about 120 years later, Swedish physicians reviewed this in this paper about this report on myocardial infarction in 1859. And it turns out this was the world's first known heart attack, myocardial infarction. That was around 1870s. And then one of your own here, a British consultant surgeon here, David S. Grimes, published this paper, An Epidemic of Coronary Heart Disease, and this paper was published in 2012. And in this paper, Dr. Grimes wrote these things. The earliest clinical pathological report of coronary heart disease was in 1859, an anecdotal case report of myocardial infarction presented to the Swedish Medical Society. He continued, the report was not known outside Sweden, and at the time it did not appear to be important. He said, the fact that this was a single case report was emphasized by, and he named the Swedish physicians who had published the previous paper that I showed. And then he said this, they drew attention to the 1859 report, contrasting it with 770 new cases of MI heart attack occurring in Malmö, Sweden in 1978 alone. And by the way, the population of Malmö, Sweden in 1978 was 237,000. And 770 of them that year alone had heart attacks. All right. So this is the world's first documented heart attack. And why did these highly experienced, esteemed physicians not know what it was? Because this set the precedent. Nobody saw heart attacks then. All right. So that's around 1859, right? Okay, now let's advance 30 years later. And this man, Sir William Osler, enters the picture. And for those of you who don't know him, William Osler is probably the most famous, most esteemed physician of the last several centuries. He is primarily known for his classic textbooks of medicine. They're called The Principles and Practice of Medicine. His first one was published in 1892, and this is my copy of it. And now much has been written about Osler's books, The Principles and Practice of Medicine. Here's one of them, written by Harold File. He said, quote, regarding the 1892 text, coronary heart disease with heart attack was not a subject of review because myocardial infarction had not yet been diagnosed clinically. Now we're in 1892, and Osler didn't know about the 1859 case. However, I've read Osler's book, I have it, and he did mention, quote, fatal cases of angina, but they were rare, and he'd never witnessed one. All right, now that was 1892. Now we're going to move ahead to 1897, and this is what Osler wrote in another paper in 1897. He wrote this, angina pectoris is a rare affection in hospital practice. During the 10 years in which I lived in Montreal, I did not see a case of the disease either in private practice or at the Montreal General Hospital. He continued, at Blockley, which is Blockley Almhouse, later known as Philadelphia General Hospital, too, he said, it was an exceedingly rare affection. I do not remember to have had a case under my personal care. Then he said this, during the 7 years in which the Johns Hopkins Hospital has been opened, there have been only 4 instances of angina pectoris. So let me review this. This was a 21-year period of Osler's both hospital and private practice experience between 1876 and 1897. Osler recounted about 6 cases of angina, perhaps not a single cardiac death, coronary heart disease death. All right? And this is where Osler was one of the founding professors of the medical school, Johns Hopkins Hospital in Baltimore, Maryland. Turns out Johns Hopkins was the 3rd largest hospital in the United States at that time. And again, in this 7-year period between 1890 and 97, Osler counted 4 cases of angina in this hospital in 7 years. Maybe not one of which was fatal. I don't know for sure. All right, so that was 1897, right? 13 years later, Sir William Osler comes here to London, England. He presents here at the Royal College of Physicians. And this is, I guess, what it looked like. And what he tells the audience is that between 1897 and 1910, that 13-year period, he witnessed an additional 208 cases of angina in that period. And this is what he said to the audience. He said, quote, "Has angina pectoris increased in the community? Has the high-pressure life of modern days made the disease more common? There is an impression among consultants in the United States that there has been an increase during the late years." That's 1910. 2 years later, back in the United States, James B. Herrick, MD, documents the first confirmed myocardial infarction heart attack in the United States, documented with autopsy evidence. And he publishes this paper, Clinical Features of Sudden Obstruction of the Coronary Arteries, in 1912. All right. Then he submits an abstract to present it here at the Association of American Physicians. This is approximately what it looked like at the time. Now, many years later, after he presents this is what he tells the same association, the Association of American Physicians, decades later. He says this, quote, "In 1912, when I arose to read my paper at the association, I was elated, for I knew I had a substantial contribution to present. I read it, and it fell flat as a pancake. No one discussed it except Emanuel Liebman, who was the moderator, and he discussed every paper read there that day. I was sunk in disappointment and despair." And he continued, then he said this, when the paper, was presented at the association. He said, "It was discussed by only one person. There was no repercussion for 6 years. It had fallen like a dud." And by the way, that statement was made in 1941, almost 30 years later after he first presented it. Nobody cared about this obstruction of the coronary arteries. They figured they're never going to see it again. It'd be like seeing a case of malaria that arises in the United States or the United Kingdom, maybe. You're never going to see it again, right? Okay, so that was 1912 when he read that paper. Let's advance all the way to 1980. And this is a paper published in Scientific American. And by this point, there's been a rise and fall of ischemic heart disease, the newer term for coronary heart disease. All right, and here's a graph, and there's many of these. We've even published one that look like this, showing cardiovascular disease deaths. This is published in the journal Circulation. And you can find many of these kinds of graphs, just to be sure. All right, so I've scoured the scientific literature, and with our small group, we've looked at all this, and we've also used artificial intelligence to help us try to assess what are the actual coronary heart disease deaths, because you have to split that out from the total heart disease deaths. You may not realize this, but in 1900, heart disease was the 4th leading cause of death in the United States, but it was almost all cardiac valvular disease, which is infectious, endocarditis, rheumatic fever, syphilis. Wasn't coronary heart disease death. Okay, so back to this. So ChatGPT AI said in 1912 there was 1 coronary heart disease death in the United States. We decided to make that 1 to 100, thinking there might be some that are missed, right? But anyway, these numbers probably get really pretty accurate now. 1922, 100 to 500 cases. 1932, 7,000 to 15,000. 1942, 40 to 60,000. All right, we'll jump ahead clear to 1972 when coronary heart disease deaths peaked in the US, 684 some thousand. All right, then they start coming down. We're down to 371,000 in 2012, and it's exactly the same in 2022, almost to the number. All right, so that graph looks like this. And this is coronary heart disease deaths, okay? Not all heart disease. All right, so think about this. We've got 1 documented coronary heart disease death in 1912, but in 2012, a century later, 371 some thousand. So statistically, this is a greater than 37 million% increase. That's pretty high. Now, let's assume they missed 999 cases in 1912. So let's assume 1,000 cases of coronary heart disease death. That still would be greater than a 37,000% increase. All right, so why am I giving you these ridiculous numbers that we can't really fathom very well? And the reason being is because, for the last 50 years, how many studies have we seen with cross-sections of the population, and even when they follow them for decades, and maybe put them on different diets for months or a few years and don't do a very good job of that, and then they come up with these ridiculous numbers after they torture the data to death, and then they say, and they look at quintiles of consumption of various things. Well, quintiles of polyunsaturated fat, saturated fat, sugar, and so on, right? And then they, as I said, torture the data until they come up with something like, well, the people who consumed 12% more polyunsaturated fat had a 15% lower mortality. Never mind the fact that the people told to consume more PUFA may also be, have healthier lifestyles. But the point is this. They're evaluating these populations where they're taking all of the subjects who were all exposed to what? The standard American diet. It creates an illusion that they've studied the matter. If it's 1948 and you're trying to figure out what causes lung cancer, are you going to study a population of 97% smokers? No, right? You'd like to study a population of maybe all smokers and a population of all non-smokers, right? Then you have something. But they never do that. They don't want to compare Americans to the Maasai or to the Catawbans or Tokelauans or any of these ancestrally living populations, because that gives it away. All right, so enough of that. Those are the references for that. Now, this is data for the UK. It looks the same, right? And that's you can see very few deaths from coronary heart disease in 1931 and climbing extensively, right? Okay. So in developed nations, in many of them, coronary heart disease deaths are coming down. But globally, look at this. Deaths from cardiovascular disease surged 60% over the last 30 years. And this is the graph. Look at this. In 1990, 12.1 million cardiovascular disease deaths in 1990. And we're all the way up to 18.6 million in 2019. All right, so today, a third of the world is dying of basically cardiovascular disease deaths, right? And 18% from cancers. All right, so on a global scale, just to sort of summarize, we had one documented coronary heart disease death in 1859. Maybe there's dozens, hundreds, maybe thousands, but not very many in the 19th century, right? But 9.1 million CHD deaths in 2019, and 20.5 million cardiovascular disease deaths in 2021. None of that matters, though, if we don't know the root cause, right? So I will submit to you that I believe it began with this, the introduction of seed oils. And the first one entered the United States in the year 1866. It's cottonseed oil, but they called it cotyledone. And nobody wanted cotyledone. They didn't want cottonseed oil because Americans knew at the time that cottonseed oil was machine lubricant. And they were using it for lamp oil. And then it was fertilizer. And they thought, well, we don't want to eat this as food. And by the way, this is what a 19th century cottonseed oil mill looked like. This is how small they began. Remember, they were making machine oil and lamp oil for the most part, mostly for very small scale. So manufacturers didn't like that. So what they did, one of the next things they did was they started adulterating olive oil with it. All right, and the French made complaint. We sent over like 70-some-thousand barrels of oil, and France made official complaint to the U.S., and they stopped importing our oil. Good for them, right? This is what happens. So the oil mills situated, they start growing, and this is what a Louisiana cottonseed oil mill looked like that was opened in 1881, and by the end of the 19th century, there were several dozen of these around the United States. And then Crisco was introduced in 1911. Now, I'm not going to go through all the history. I don't have time. But But basically around this time, the edible oil industry was born. This is basically what happened. So cottonseed oil introduced in 1866, then corn oil about 1900, soybean oil 1909, Crisco in 1911, and then I'm just going to name the others, all right? Sesame oil, peanut oil, rapeseed oil, safflower oil, sunflower oil, canola oil, rice bran oil, and grapeseed oil. All of these entered the food supply because there was a lot of money to be made in the edible oil industry. So what happened is that vegetable oils began to replace animal fats in the diet, right? And now, today, this is what an edible oil refinery looks like. You really can't hardly tell many of them apart from a petroleum refinery, right? And one of these can produce 1.6 million gallons of edible oil in one day. It's a staggering business. All right, now this is our published graph published in Medical Hypotheses in 2017. And I want to show you here. So in 1865, there was no seed oil consumption in the US. We had trivial amounts of olive oil because almost no one could get olive oil. They used more in cosmetics than they ate. They couldn't afford to eat it, right? And almost nobody had it because mostly came from Europe. All right, but anyway, so by 2010, we grew from basically zero in 1865 to 80 grams per person per day by 2010. 80 grams, folks, is 720 calories worth of food. That's 32% of US caloric intake. All right, now, in 1900, 99% of added fats to the diet, added fats, came from animal fat, lard, butter, and beef tallow, basically. But by 2005, 86% of added fats came from vegetable oil. And it's still growing. It's still going up. We're still replacing more. All right, so that's the consumption. Now look at this. We published this also in 2017. Look at the correlation here between vegetable oils in the black and heart disease deaths in the red. And I hope you can all see a very, very strong correlation there. And look at saturated fat in the purple. It is flat. Saturated fat was 50 grams per person per day in 1909 in the US and 59 grams a day in 1999, 90 years later. It barely changed. All right, so now we also know that cigarette smoking is a big factor in coronary heart disease and stroke. And this is from our own CDC. Smoking increases coronary heart disease and stroke 2 to 4-fold. We all know this, all right? So we've estimated those coronary heart disease deaths and plotted it against smoking. Now, isn't this powerful? Look at this. So you can see that smoking increased in the US until 1948, I believe it was. It peaked at around 45%. Then it began to come down. And 18 years later, after the smoking prevalence starts coming down, the coronary heart disease deaths start coming down. Pretty interesting. It makes sense to me because there's a pretty long effect after quitting smoking, right? It's going to damage your arteries for a long time. So now I'm going to bring vegetable oils into this. And you could just see the correlation there. Now, I think this is, to me, it's making a lot more sense that this is all coming together, all right? And then what we did was we tried to take out all the smokers. So we took out the number of coronary heart disease deaths consistent with the prevalence of smoking for that year to theoretically, hypothetically, remove the smokers from the situation. So now you can see the graph is looking a little bit closer, right? However, the vegetable oils are still going up when the coronary heart disease deaths are coming down, right? What's going on there? Now, this is something I've suspected for 10 years. I believe there's a threshold effect here, all right? This is exactly what we see in cancer. So we know in cancer from Clement Ip's work back in the 80s that as you increase the omega-6 linoleic acid, starting at 0.2 or 0.5%, up to 4.4%, rodents get more and more cancer. up to a threshold of 4.4% omega-6 linoleic acid. After that, they get no more cancer, right? It doesn't worsen, all right? I think we've got the same thing here. If you look at this graph at approximately 45 grams of vegetable oils, we're not really seeing any more coronary heart disease, all right? So I believe there's a threshold effect. So why is it still coming down then? Well, that's interventions. What physicians and surgeons are doing is making a difference, all right? And we maybe can't fully account for the effect of the smoking. But to me, this all makes a lot of sense. So how about the mechanism? So James DiNicolantonio and James O'Keefe published this paper, Omega-6 Vegetable Oils as a Driver of Coronary Heart Disease, the Oxidized Linoleic Acid Hypothesis. This is a brilliant paper. If you haven't read this, read it. It's a very short read, and it just makes so much sense. So vegetable oils, rich in omega-6 linoleic acid, the linoleic acid, or LA, is incorporated into the LDL, makes the LDL rich in LA, and unsaturated fats are prone to oxidation, right, because of the double bond. So LDL oxidizes, and this is then pulled out of circulation and deposited into an atherosclerotic plaque. It can both initiate and cause progression of the plaque. There we go. That's as much as 99.9% of the world wants to know, right? So I will submit to you that there are two primary drivers of coronary heart disease. One, seed oils. Sorry, the graphic didn't come out there quite right, but anyway, seed oils, and then smoking. And I will submit to you, seed oils is much, much, much more powerful than smoking. Why do I say that? There's two populations, ancestrally living populations around the world, that smoke like fiends, and they don't have any vegetable oils, and they don't get coronary heart disease. Those are the Catawbans and the Papua New Guineans of Tukasinta. And neither one have vegetable oils. And I lived among the Papua New Guineans for a week a couple years ago. And they smoke like crazy, and they live in smoke-filled huts, and they don't get lung cancer, and they don't get heart attacks or known coronary heart disease. That was published by Sinnott and White way back in 1972. You can look that up. All right. So are there populations without coronary heart disease? Well, there's these, the Maasai tribe of Kenya and Tanzania, the Chamane of Bolivia, the Catawbans of Catawba, the Inuit of northern Canada and Alaska, the Tarahumara Indians of northern Mexico, the Papua New Guineans of Tukasinta that I just mentioned, they're highlanders, live off of sweet potatoes almost exclusively, Tokelauans of Tokelau, the Ashe of Paraguay, the Hadza of Tanzania, also the San Bushmen of southern Africa, the Yanomami Indians of Brazil and Venezuela, Okinawans pre-1960s, and don't forget 19th century Americans, which we just reviewed. So all in total, right here, we've got the coronary heart disease is rare or absent in all 13 populations, all right? Now, some get atherosclerosis, but it doesn't hurt them. All right, it rarely leads to symptomatic coronary heart disease or myocardial infarction. All right, and what do all these populations, or what is absent from their diets? And the answer is industrial seed oils. And of course, they don't have processed foods, but I want to make it clear, they don't have industrial seed oils. These are the references for what I just showed you, all right? Now, what about other chronic diseases that are rare or absent in these populations? So, of course, coronary heart disease we just reviewed. Also, hypertension, stroke, cancer of any type, including lung cancer in the smokers, metabolic syndrome, diabetes, Alzheimer's disease, dementia, age-related macular degeneration, proven in the Papua New Guineans of Tukasinta. They didn't have any. Dyslipidemia, abnormal lipids, that is, Parkinson's disease, depression, anxiety, and multiple sclerosis, and autoimmune. And there's a whole further list, all right? So, but again, they have little or no industrial seed oils. Can you imagine hunter-gatherers with their vegetable oil bottle? Where would they get vegetable oil? And there's people who will say, well, maybe vegetable oil will make them healthier. I'm like, how could you make these people healthier? How is that possible? All right, so this is a graph we have pending publication. And this is the world's consumption of vegetable oils. And this is what we've estimated based on all of the scientific literature, that we were less than 0.1 gram per person per day in 1865. Again, globally, we're about 0.2 grams per person per day in 1900, 15.5 grams a day in 1961, 65.4 grams per person per day in 2014. All right? So this is about a 650-fold increase in vegetable oil consumption since 1865. Now, I want to bring you back to this, that there was one documented coronary heart disease death in the world in 1859. What was seed oil consumption then? Less than 1/10 of a gram per person per day. All right? In 2019, 9.1 million CHD deaths. Vegetable oil consumption, roughly 65.4 grams per day. All right? Now, but it's not just coronary heart disease. Look at this. This is all, I mean, not all, but a number of the most prominent chronic diseases, right? You see the CHD deaths, but look at obesity. And so I'm just give you the numbers. I won't go through all the data, but the obesity, this is all in the United States, is up 35-fold since 1900. Diabetes is up 5,643-fold. It was 0.0028% in 1890. That's Sir William Osler's data. We're at 15.8% of diabetes today. Cancer deaths up 62-fold since 1811. And then CHD deaths up, what, tens of thousands-fold or possibly more, all right? What's it related to? Well, look at the vegetable oils versus all of these, right? There's an extraordinary correlation. And I've looked at almost everything you can think of. Nothing has this correlation, including sugar, which we're going to see in a moment. All right? So this is what I would submit to you, that we're healthy, fit, chronic disease-free people in the U.S. in 1900. It's pretty much the same around the world. Vegetable oils enters the picture 100 years later or so. We're just literally plagued by obesity, diabetes, cancer, coronary heart disease, Alzheimer's, age-related macular degeneration, virtually all the chronic diseases. Why are they all running together? This looks like evidence to me we're being poisoned. And that's why I believe this is a metabolic poison. There's many reasons why. Now, this is all the time I have to go through the pathophysiology, but industrial seed oils, rich in omega-6 fat, rich in advanced lipid oxidation end products. They accumulate in our bodies, they accumulate in our adipose, in our cell membranes, and our inner mitochondrial membranes. And this sets up a biological milieu that is pro-oxidative, pro-inflammatory, toxic, and nutrient deficient. This is the perfect recipe to drive metabolic disease and physical degeneration. So look at this. Here's the correlation between vegetable oils and obesity in the United States. You can see obesity, 1.2% in 1900. Vegetable oil consumption that year, 1.6 grams per person. 1960, when obesity was 13.4%, vegetable oil consumption, 19 grams per person. Obesity, 42.5% in 2018. Let me go back. Vegetable oil consumption, 81 grams per person per day. Higher than it was in 2010 even, if you can imagine. But here's sugar consumption. Look at the disconnect already. For example, just give you this quickly. Obesity elevated from about 3% in 1930 to 42.5% in 2018, while sugar increased only 5.4%. It's a 27-calorie difference between the two dates. Believe it or not, all this data is published. You could go look all this up yourselves. It's been published by the USDA, Stephan Guyenet. We've published it, all in scientific literature. Now, what's the definition of added sugar? So the Food and Agriculture Organization and the USDA use the exact same definition. This is it. I'll read it to you. Added sugars include sugars added during the processing of foods such as sucrose and dextrose, foods packaged as sweeteners such as table sugar, sugars from syrups and honey, and sugars from concentrated fruit or vegetable juices. It's every form of added sugar there is. It's not fruit sugar or vegetable sugar, but it's every other form. Now you will get this question, well, are these numbers from the USDA and the FAO, are they accurate? Because there's been this claim made There are 56 different names for sugar, so national statistics miss most of it. Now, I won't mention names. I've got a lot of friends in this field. I don't agree with all of them, but we're still friends and colleagues, all right? Now, but here's the facts. The USDA and the FAO, they track sugar at the source, not at the retail level, all right? How do they track it? The total is the production plus imports minus exports, plus or minus the stock changes. And so here are the core sugar commodities that they're measuring: cane sugar, beet sugar, corn sweeteners, including high fructose corn syrup, all syrups like maple syrup, honey, glucose, dextrose, and molasses. And I asked ChatGPT about this question, and this is what ChatGPT AI said, quote, "The claim that sugar is underreported due to naming conventions at the point of sale is false and misleading." Not my words. That comes from ChatGPT. I won't own it, but I believe it. All right? All right. So we're back to the U.S. Look at this. Now, I picked this period specifically. Again, and people look at this graph and they say, oh, no. Sugar couldn't have been stable for 65 years. This is between 1922 and 1987, but I showed you the graph. We've increased our sugar consumption 17-fold since 1922, but almost all of the increase occurred before 1922. So I picked this period, 1922 to 1987, for this reason, because sugar's flat. 473 calories in 1922, 497 calories in 1987, right? But look at the vegetable oil consumption: 78 calories in 1922, 550 calories in 1987, while obesity rises from 2.95% to 18.6%. All right? So during this period, sugar increased 5%, vegetable oils increased 605%, and obesity increased 532% over a 65-year period. Okay? Now, it's the same thing with diabetes. I won't go through the numbers, but diabetes increased 29-fold during the exact same period, while the sugar is flat. But the vegetable oils went up more than 7-fold, 605%. 29-fold increase in diabetes. So what about the much maligned carbohydrates versus obesity and diabetes? So here we have carbohydrate consumption between 1909 to 2017. This data comes from the USDA. And look at carbohydrate consumption versus obesity. Anybody see a correlation here? Okay, I don't either. This is carbohydrate consumption versus diabetes. Carbs are flat. Okay, so a year ago, a colleague sent me this article. This is not a paper, this is an article. And as you can see, it's entitled, "How is France Dodging the Global Obesity Trend?" And in this article, they used a graph from somebody who's pretty smart. I have no idea who this person was, but they're pretty sharp. And what they did is they got all the World Health Organization data for 18 countries, all right? And these 18 countries represent more than half of the world because they include China, India, the United States, Mexico, Brazil, Argentina, and it includes nations on all inhabited continents. Anyway, take a look at that. All of them, obesity is going up, except, I'm going to highlight it, France. After 2008, obesity in France started going down. And I said, I've got to dig into this, all right? Because I wasn't aware any country had obesity going down in the last few decades until I saw this. So I got the data myself. And I work with colleagues that help me plot all this. All right, so here's all of those. I pulled France out, so we got the other 17 countries, all right? Look at the obesity, all of them going up from 1990 to 2022, way up, right? And then I got the data on diabetes, also from the World Health Organization, all of them going up, all right? Now, a couple go up and come down, but overall, the trend on even those is up, all right? So now, let's look at vegetable oils. Here's vegetable oils since 1961 to 2022. This all comes from the FAO, all right? Look at that. They're all going way up, right? Now look at vegetable oils from 1990 to 2022. They are also all way up. Okay, these graphs are messy, right? Because you got all the data there, so you got all these sawtooth patterns. So in those situations, I create trends. We just got a beginning and ending point. And you can see vegetable oil from 1961, every single one of these 17 countries, France is not in here right now, they're all way up. And this is from 1990, they're also all up. Okay? So now let's look at sugar. So here's sugar consumption since 1961. Now look at this. It goes up in the beginning, and then they almost all flatten. And we're going to make this simpler in a moment, but there you go. I hope you can see it's quite flat. It's very similar to what we've been seeing in the US in the last 50 years or so, right? This is sugar consumption in all 17 countries from 1990 to 2022. All right, and they're all mostly flat, right? Okay, here's the trends. Now, since 1961, about half are up and about half are down overall. That's since 1961 on sugar. But here since 1990, most of them look like they're going down to me, all right, without getting into the nitty-gritty. All right, so now we're going to convert those into single lines momentarily. But here's the single line. So we take all the data from the 17 countries, year by year, plot it into one single line, and here it is. That's for the 17 countries, representing more than half of the world. It's about 51% of the population, all right? It begins at 150 calories a day in 1961, 450 calories at the end. Vegetable oil triples in 17 countries in the last 60 years. All right, the total sugar consumption, take a look at that. So you can see between 1961 and 2022, sugar didn't change a whole lot, but this is what's really important to know. It decreased after 1980, on average, for over half the world. So let's put all this together. So now we have obesity and diabetes, which both went up about twofold overall for the 17 countries, right in parallel, in lockstep with the vegetable oils. But look at the sugar, flat and then going down. So the sugar's going down while the obesity and diabetes are going up, again, for over half the world. All right, let's go back to France. This is that same graph. And so I dug up the data. I got the data on France. This took a year to get all this data together. Look at the obesity in the red versus the vegetable oils in the blue. The vegetable oils start going down in 2008, almost precisely when the obesity goes down. And the obesity goes down from 2008 to 2018, a decade. But look at the sugar. It's sawtooth, but overall it's flat. It's not going up. And let's look at the carbohydrate consumption. So here's the carbs versus obesity in France. Absolutely zero correlation again. All right. Now, I got the data on diabetes. There's only a 10-year period of data in diabetes in France, 2008 to 2018. Just happened to correlate with this. So we plugged this together. So look at the diabetes going down precisely when the vegetable oil goes down, and look at the sugar, again, it's virtually flat. So now, this is zoomed in just so we can see it move together. Look at the vegetable oil going down, same time that the diabetes does, and sugar's virtually not changing. And then this is diabetes in France versus carbohydrates. Look at the diabetes going down while the carbohydrates go up. So, in summary about France, France is the only country that I know of where obesity and diabetes have both declined for an entire decade. And this occurred precisely during a drop in vegetable oil consumption with no overall decline in sugar or carbohydrate consumption. So now let's go back to the 17 countries. What about the carbohydrate consumption in them? So I don't have the data back to 1961 yet. But here's the carb consumption in the 17 countries from 1990 to 2022. Look at that, they're flat. And here's the trend lines for those. And you can see, they're mostly all flat, all right? And so one line, carbohydrate consumption's flat, and look at the obesity and diabetes doubling without any change in carbohydrates. So let's put all this together into one graph. So this is for all 17 countries. Look at the obesity and diabetes doubling while the vegetable oil tracks precisely with it, Carbohydrates flat, sugar flat, and then going down. So ladies and gentlemen, I would submit to you that these factory fats, these industrial seed oils, are dangerous fats. I've been calling these chronic metabolic biological poisons since 2019. And I just want to show you this diagram, this schematic. I don't know what to call this, but this simulates the total vegetable oil consumption that the world would consume in a day, sitting smack dab in the middle of Manhattan, New York City. This container would be 52 stories high by about 19 stories per side and contains 235 million gallons of oil, 510 million liters. It would look kind of like this, all right? Again, this is simulated, so it's not perfect, right? But what I'll submit to you is that the huge bulk of this is chronic metabolic poison. So, is there a poison hidden in plain sight? So, in closing, I would say to you, we're all here for one fundamental reason, and that's to learn how to prevent and reverse chronic disease. So, in that quest, have we overlooked the single most processed, most pernicious and insidious ingredient in the food supply? I'll leave it to you to decide. Thank you.